My name is Tim DeWeese, and I am the Director of Johnson County Mental Health Services. And I have been involved with NAMI for the past 30 years, primarily as an advocate and help support members of NAMI, not only to get the services or to have access to the services that they or their loved ones need, but also to promote mental wellness and well-being within and throughout our community. I also served on the Kansas NAMI board for a number of years. So my belief is that we can help one another, and that mental health issues and mental illness are not just the responsibility of the mental health center or the mental health community, but that it's our responsibility as a community at large to help support. And so NAMI is one of those entities that really promotes that and helps support not only those individuals that have a lived experience with mental illness, but the family members that walk that journey beside them. So I think the single most important thing that any one of us can do is to have those difficult conversations with one another. It's not easy. It's not easy to ask someone if they're having thoughts of suicide, but the more we have conversations about that uncomfortable topic, the more we do a couple of things. The first, we reduce stigma, and we actually make it easier for people to seek help. And second, we bring this notion out of the darkness, and the more we can talk about it, the more we can share with one another our own experiences and our own feelings and find ways to support one another, then I think ultimately that's how we reduce the number of deaths by suicide. So I think it's difficult for any of us to have that conversation regarding suicide with people that we know or even people that we've just met. I think one of the things that I think is really important for us to remember is that it's been difficult to talk about all kinds of health conditions over the years. 20 years ago, we wouldn't talk about cancer. We referred to it as the C word, and people were embarrassed to talk about whether they had cancer. Today, we would talk openly about breast cancer. We talk openly about testicular cancer, or any kind of cancer. And so my hope is that one day we can talk as openly about suicide and mental well-being, about our feelings and how we're experiencing emotions. Those are the things that I think make having those conversations difficult. But we are able to do it, and it gets easier with practice. One of the things I think we also have to get comfortable with is what I would call an awkward silence. So if we ask someone a question about how they're doing, or if they're having feelings of self-harm or feelings of suicide, that we allow ourselves to be quiet for a minute and allow an individual to answer. So it's really the awkward part is getting over that awkwardness of the silence. And we have to be able to be comfortable with that silence and allow the person to process what you've asked them and then respond. The easiest way to get help in Johnson County is to contact our 24-hour crisis line. You can access that line by calling 913-268-0156. And while I say that's a crisis line, there's no wrong call. You can call for any reason. If you want information, if you're needing help, or if you're in an immediate crisis, you can call that number. Again, 913-268-0156.